Watch this.
Overwhelming, emotional, angry. Doctors take us inside a Boise intensive care unit as they work to save the lives of COVID patients who are overwhelming Idaho's hospitals. And rural hospitals, like the one in Rupert, where there's only one ICU bed for the nearly 6,000 residents. How are they coping with the influx of patients needing care? And they're dropping low. The water levels, that is. And the difference in just 2 months at one popular reservoir is staggering. For weeks, we've stood here and told you about the worsening COVID situation in the state of Idaho. Sure, early this summer, we told you about COVID and it looking actually pretty promising. But now, we're in the darkest time our state has faced since COVID infections began in Idaho back in March of 2020. In recent months, weeks, and days, we've watched the Delta variant cause a surge to the like of which we had not seen here in the state. Then we watched part of the state going to crisis standards of care, and then a week ago, the entire state of Idaho going to operating under critical conditions. And even that dire declaration hasn't seemed to slow the outbreak or devastation that COVID is having on our healthcare systems and our community. As of Monday, 760 people are in Idaho's hospitals with COVID. 202 are in the ICU. Both of those are record highs. And those numbers are likely higher as not all hospitals have submitted their data yet this week. Now, these numbers we have told you over and over again, and we're going to continue to tell you about them, even though we may sound like a broken record. But why do we continue to tell you this? Well, we can't stress this enough. We are in a dire situation, and that continues to be a daily reality for our healthcare professionals and our healthcare system. But for the first time, we're seeing what it's like inside of our hospitals with a firsthand experience. Ryan Holmes and photojournalist Kevin Esslinger were able to go inside the intensive care unit at St. Alphonsus in Boise this morning. Brian, how would you describe the scene inside St. Alphonsus?
Well, Joe, it was very powerful, to say the least, inside St. Alphonsus today. And I kind of want to piggyback on some of the numbers you just threw out there. This morning, they were caring for 87, nearly 90 COVID patients here at St. Alphonsus. In Nampa, 50% of their facility there is dealing with COVID patients. 50% of their facility are COVID patients in Nampa. They had 5 patients die of COVID here just yesterday, 5 of them. We were granted access to 3 departments here this morning. The emergency department, the ICU floor, and we also were into the intensive care unit as well. We wanted to see what the situation was like and talk to the people that have had to deal with this situation that they've never had to deal with at any time during this pandemic, but they're dealing with this today. We were taken to the emergency department, where some patients who would normally be kept for observation, they're being sent home shortly after receiving treatment, so they're not staying as long as they usually would. The normal wait time there, if you're going to be admitted to the hospital in the emergency department, we're told usually around 120 minutes. That's the longest. These days, a patient could wait a minimum of 4 hours and sometimes as long as 16 hours. And they also had to convert a storage room there in the emergency department, a storage room that now holds 6 patients, or has the potential to hold 6 patients. Then up on the 9th floor, which is normally an orthopedic floor, they've taken what is usually a rehab gymnasium, a rehab gym, a room where patients go to work out and rehab. Well, they can hold 6 COVID patients there. Yesterday, it was filled. They don't have any in there today, but likely, we were told, they'll be putting more patients in there soon. Meanwhile, in the ICU, where all 22 rooms are filled, the majority of them COVID patients, all of them unvaccinated. They're operating with 4 doctors each shift, where normally they would just have 2 doctors on staff. And that doesn't include the dozens of nurses and the other staff on hand for their 12-hour shifts. And that's not even the only ICU here at St. Alphonsus. They've had to convert the cardiac ICU into a COVID ICU, and it has 10 rooms in it. All of them are filled with COVID patients. We were told after we were shown that room there, where they have now taken a day surgery, where they do outpatient surgery, they converted that to a potential ICU for COVID patients. And we were told after we saw that room today, they're likely going to start moving some patients into that room. Out of the 40 patients, a couple more numbers for you. Out of the 40 patients that are on that COVID floor, we were told 2 of them are vaccinated, just 2 out of the 40. Out of the 22 patients in the main ICU, 20 of them have been intubated and are on a ventilator. From those 3 departments today, the ER, the COVID floor that we talked about, and the ICU, we spoke to 3 doctors and a nurse. The nurse told us she lost a patient yesterday, one of the 5 that they lost here at St. Alphonsus yesterday. They weren't on a ventilator, they weren't in the ICU, They were just on the regular COVID floor, but they had done all that they could there to save this patient, and it still wasn't enough. She told us today she can't even count how many patients she has lost in the 18 months that she has been here and serving during this pandemic. But yet she comes back every day because she knows that she is needed.
It's funny how you're able to figure out how you're going to cope with that. But I will say that yesterday was extremely difficult. You take your 60 seconds in the med room, you cry, you clean up your tears the best you can, and then you go back in because you know that that family needs you to be there.
Do you see the light at the end of the tunnel at all?
No.
You don't?
No. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is, right? I will do this code blue, have to console a family member, you know, because their loved one died from COVID, and then turn around and see that there's a big music festival, you know, downtown, that people are going to large gatherings and not wearing their masks. And I get it, people feel like they want to keep living their lives, and we're not asking people to put everything on hold indefinitely, but I mean, we're in the biggest surge that we've ever experienced. This is the first time that our state has declared crisis standards of care, and many people in the community are going about their lives as if there's nothing different going on.
You know, Joe, it's not all doom and gloom here at St. Alphonsus. There are many successes that they are celebrating, and it's worth celebrating. In fact, in a hallway by the employee entrance, they put up a tally of how many people they have saved and were able to send home during this pandemic. Today, that number was increased to 2,462. Doctors, nurses, support staff, they walk by that poster every day, and they can see the good work that they are doing and why it matters that they show up every day. Carrie Smith, that nurse that we spoke with, she says it's a privilege to be in that room with a patient who is passing from COVID and to be there with their family. Because again, as she said, she knows that she is needed, and that's where she needs to be. It matters because, as you heard, days like this can be pretty heavy. They can take their toll on the staff and the doctors, the nurses, everybody here at St. Alphonsus. Dr. McInerney told us that the hardest part coming to work isn't the physical toll, it isn't the emotional toll, it's worrying about whether or not you can have enough staff to care for all the patients that are here at the hospital. She is the ICU director, and that is her job, just one of her jobs, because she also makes rounds, and she also does everything else that comes with being in the ICU. And as I mentioned, it can be a heavy situation. 3 patients coded here at St. Alphonsus this morning while we were, well, not while we were here, one of them did while we were here. And it was impressive to see this staff respond the way that they did. Everybody focused on that room. The people that had to get in there got in there. There were no fewer than a dozen people working on this patient who was coding. What impressed me the most, Joe, I'll just leave you with this, is that the number of people that put their entire focus on that room at that time was impressive. There wasn't one person who wasn't occupied doing something else and caring for a patient that wasn't there willing to offer a hand, or at the very least, offer support for what was going on in that room. I thought I was ready for what I saw today, but we saw some stuff today, Joe, and it wasn't always pretty. But just know that the people inside this building and every one of these hospitals in the Treasure Valley and across the state are doing everything they can to not be in this situation. And every day we bring you these stories of how they're begging you to not put them in this situation. Some of them are unavoidable. We get that. They get that. But I don't know if we can say it enough, how much they really, really, really need help from outside these walls.
So Brian Holmes reporting from St. Alphonsus in Boise. Brian, I know we'll be hearing more from you in the coming days about what you saw in the ICU. Thank you for your report.
Yep.
Well, moving on about 2.5 hours to the east is Minidoka Memorial Hospital in Rupert, Idaho. The town, which is home to about 6,000 people, has just one ICU bed, just one. And as cases continue to go up, their small rural hospital is having to take on more and more patients. Now, this is a look we're going to show you right here at cases in Minidoka County. Their 7-day moving average, 57 cases, which isn't as high as it was back in the December surge, but you can see that they're continuing to increase and approaching that point. What this graph doesn't show is what their hospital system is seeing in terms of pressure. Katya Stepovic is live for us this evening in Rupert, just outside Minidoka Memorial. And Katya, we just heard from Brian about what he's seeing in St. Alphonsus and Boise. Describe to us what you're seeing in Minidoka.
Joe, I mean, Brian put it pretty bleak there, and there's not much more I can add, to be honest. The situation today we saw was really tough. We talk about these statistics and we talk about these numbers all the time, but it's one thing when you see these people fighting, battling, and losing this battle against COVID-19. And here at Minidoka Memorial, they had that added pressure of limited resources. They are a small hospital, and while they're not operating under crisis standards of care right now, they say that that can happen any day now. Now, Minidoka is a smaller hospital, and they've been taking patients from St. Luke's in Magic Valley, and they can only take patients if they're not tubed and do not require a ventilator because of limited resources. Every day, the emergency waiting room is flooded with people because they only have 7 ER beds and 1 ICU bed, just one single ICU bed, with only a couple COVID rooms left to take new patients. And like we have said time and time again, this hospital too is seeing the most COVID patients they have ever seen. They are more sick and they are dying.
It is scary because we've never had to do this before. And you know, every life matters to us. And we can only do what we humanly possibly can do with the resources we have. And on top of COVID, we have other emergencies. It is really hard to put yourself in their position, thinking if that was your husband on the bed dying and you can't be with them or your children can't come in. You know, it's hard to just let them sit there and watch it happen.
The challenge here is transferring patients who need higher levels of care to other hospitals like St. Luke's and Twin Falls or Magic Valley, because they too are completely full. And surrounding states are telling Minidoka Memorial that they cannot send any more patients out of state. And I talked to Kelsey, the head ER nurse that you heard from today, and I said, what happens if we keep going in this direction, if we keep seeing more COVID patients here in Minidoka Memorial? And she said they're talking right now about putting cots in conference rooms and the hallways at this hospital. Brian. Joe.
Katya, I got a real quick question for you. I know with some of our rural hospitals in the beginning of the pandemic, there was concerns about visitation. They just didn't have the space to have families to come in and safely meet with people. Has that been addressed? Has things changed in Minidoka?
No, patients and family members cannot come in and see their loved ones. It is very strict protocol here, but the one thing that they do have the advantage of, and you can see right behind me, they're a 1-level hospital, so loved ones can come up, and you can see someone was here earlier today at door and unit 110 talking to their loved one through this glass window. And we saw it earlier today. On the other side, I saw a family saying hello and saying their thoughts and prayers to their 94-year-old mother and grandmother. She's been in here for 4 days, and they're just hoping that she can come out any day now. So this is real, and it's really, really tough to see.
That's Katya Stepovic reporting live in Minidoka. Thank you, Katya. And there's something I just need to say. We cannot understand what's going on inside these ICUs in these hospitals, and that fully registers with me today because both Brian and Katya have been covering COVID every single day for months as it got worse and worse. And they're very familiar with the numbers. They've done the interviews. They've talked to the experts. But I saw something different in Brian and Katya this afternoon, just live here, after they were inside the hospital and shared their experience. It's a side of emotion that we cannot understand just watching on television. So please, when we have healthcare workers telling us that they need our help and they're begging us for our help, and we have Brian and Katya out there who clearly have seen something that we cannot understand through a screen, this is how serious it is right now. So when we have our healthcare experts begging the community to please listen to the experts and listen to the firsthand stories, this is what we're talking about. I have not been inside an ICU. I cannot tell you exactly what it's like, but please listen to Brian and Katya and all the frontline healthcare workers that are inside doing the work day in and day out. And both Brian and Katia will share their full experiences inside both ICUs coming up on Sunday night, a special edition on the news at 10. And then coming up here on Monday, right here on the 208, we're going to have extended versions of both of those stories. Well, today marks 1 week since crisis standards of care were activated for the full state of Idaho, and that declaration was made after a request came from the St. Luke's health system. A week ago, they were simply overloaded with very sick people with COVID infections, and they could not go on that way. So today we checked in with St. Luke's leaders for insight on what the last week has been like. And I asked St. Luke's Chief Medical Officer, Dr. Frank Johnson, about the last week and if things appear to be getting better, worse, or staying about the same.
Today, we hit a new high for hospitalized COVID patients in our system. We were at 315 hospitalized COVID patients. That's worse. Back at the end of July, we had 30 patients hospitalized with COVID. So in a really short period of time, we've had a tenfold increase. That's worse. Our ICU capacity is at all-time highs, and we've added additional space to those surge ICU beds. That's worse. Our numbers of deaths from COVID continue to rise. So we're worse.
Again, healthcare systems tell us they need our help. Leaders ask, please get vaccinated, wear a mask when you can't distance in crowds, and please, please, please continue to support our healthcare workers. Today we gave you insight from just one day inside the crisis our medical system is going through in the state of Idaho. And medical professionals, they've been doing this nonstop for 18 months. Let's support our healthcare leaders. Let's support our healthcare frontline workers. We've heard today how much we need them. And I'll say it again, they could use us. Well, it's officially the fall season, and I'm assuming most of us have put away the swimsuits and water toys, at least for the year. And if you haven't, you might want to consider it because water levels at most of our local lakes and reservoirs, they're going down, and they're going down very fast. Check out this drone video. It was taken by photojournalist Gary Salzman. He got some of the best shots I've ever seen on our drone. Now, back in mid-July up at Lucky Peak Reservoir, this is what the scene looked like. A few days later, the Army Corps of Engineers started dropping water levels, and that's common, but it usually doesn't happen until late August or early September. But because of Idaho's ongoing drought and extreme dry conditions, the water from Lucky Peak was needed for irrigation. Let's show you some new video. This was taken just yesterday here in September. You can see that the water is all but gone, and that mud you see on your screen, that's the riverbed with little puddles of water scattered about. And that's all that's left here. We'll show you the difference here, and you're going to see a real contrast between just 2 months. And again, this is pretty sudden. We should explain. This dramatic drop down does happen every year, but not usually until the wintertime, at which point wildlife uses the riverbed just to cross over. So again, here's July 2021, 2 months ago. Again, to your left, just yesterday. This is the same spot. In July, Lucky Peak was 97% full. Today, it is 15% full. So for those of you who are new to the valley, Lucky Peak Reservoir is just part of 3 reservoirs that make up the Boise system. It also includes Arrow Rock and Anderson Ranch, and you take one more look there. September 2021, a world apart from what we saw only a few months back. In July, the reservoir up there at Lucky Peak, it was 59% full. Right now it's 24% full. Arrow Rock, which sits just above Lucky Peak actually, it is 16% full, but they haven't seen as dramatic of a drop-off because they were only 27% full back in July. And Anderson Ranch, which sits above Arrow Rock, is 35% full there.
Great pictures. You're looking at the first full day of fall. It feels like fall outside, doesn't it? The temperatures. Highs today were only in the mid 70s or so. It's very pleasant up here in McCall. So we'll get to some of those temperatures here in just a second. You see the sunshine coming in and people still playing around the lake. Not as much, of course, during the week. However, this high today of 77 is right on the average of 77. 51 this morning. We're pretty close to average with these temperatures. Now they're going to warm up this weekend, but they're not going to be records. Records are in the 90s, and I say goodbye to the 90s. We do need more precipitation. It doesn't look like that's too probable. We get into next week. Of course, getting into next Tuesday and Wednesday, we may be seeing a chance of a shower there that might help us out a little. We'll be watching that. So here's the high temperatures for today. The 77 you saw in Boise, same thing for Nampa. Caldwell was 78. 83 degrees in Ontario, 70 in Twin. See only 68 in Stanley. Mainly the 60s in the mountains today. And high temperatures around the Magic Valley for tomorrow. This is your forecast. Mainly getting into the mid 70s, lower 70s for the Central Mountains. And when you look at the West Central Mountains, 74 for McCall, 83 degrees for Garden Valley. Down here in Valley locations, temperatures will get above 80 degrees for tomorrow. We've got about 4 days where these temperatures will be 80 or above. And when you look at the 7-day forecast, you'll see that into Saturday and Sunday. And next week will cool down with a chance of a shower. Back in a minute.
Well, that's all the time we have on the 208 this evening. I just want to say we saw a lot of your text messages come in, a lot of the same ideas. Thank you to our healthcare workers. We're thinking of you tonight.